Anisa Kadri reports.
Juliet Fitzpatrick is now in recovery after a physical and emotional battle with breast cancer. She says the chemotherapy that followed her diagnosis turned her into a horrible person to live with.
I think for me the worst thing about it was the emotional side. I got used to losing my hair and going around bald, but I just felt so depressed and not wanting to talk to anybody, and really it was just that feeling of wanting to be away from the world, actually.
Doctors say new research means thousands of women with the most common form of early-stage breast cancer could be spared chemotherapy. Trials of a genetic test have found that the treatment can be safely avoided without affecting outcomes. The test is carried out after surgery to see whether a tumour is likely to spread, and people get a score out of 100. Women who score 0 to 10 are considered low risk. There's no benefit in having chemotherapy. At the other end of the scale, people who score over 26, there's a definite benefit. But there's a grey area for most patients who are in between. The findings suggested that for those patients aged over 50, chemotherapy wasn't needed. It's estimated this could affect around 3,000 British women a year.
There's always been this uncertainty about what the best recommendation was for the 2/3 of women who had a test in the mid-range, and this trial definitively addresses that very important question.
A leading breast cancer charity is calling for changes in cancer treatment.
Some clinicians will update their practice immediately because the results of this study are so significant. And that's why we want to see the clinical guidance updated so that more patients can benefit across the NHS.
The trial is another step in trying to provide more tailored treatment for breast cancer patients. Anisa Kadri, BBC News.